Dr. Jessie here with
Dr. Mariah.
And we are going to talk all things sciatica, but not true sciatica because we're talking pregnancy as it relates to sciatica type symptoms. But it's not due to the disc, the way we are used to seeing it as healthcare professionals. This is really important to note because it changes how you end up treating it. So again, this is the, excuse me, the condensed version of what we've done on the continuing education side. So we're hoping that this will just condense everything for you. So if you need to reference in quickly to know how you want to be treating patients, what you want to provide them with, that's what this will become. We are going to start with the nerve flossing. Excuse me. Oh my goodness. It's because I'm up here talking. Go ahead and have a seat.
Okay.
So you are literally going to follow the foot with the head. Foot with the head. And again, you're creating that movement, that fluid movement, kind of the friction between the nerve and everything you're sitting on. But this is only going to help with the health of the nerves that are causing that pull, right? Again, not true sciatica, so you don't need to worry as much about the disc. Though I will say this, because it's positional, it has to do with the pressure that you're getting through this area and that rotation of the pelvis. This all will help keep those discs hydrated, so it doesn't hurt either, right? It's good. Ball release. We need a ball. We need a ball. We need a ball. Okay, so she's going to sit on the ball, right where that piriformis is, and this is going to dramatically help to stretch that piriformis muscle at home. So one of the tools you can give your patients, same with the nerve flossing that we just did. This is definitely something that's great though when you don't have a partner at home to dig, right? Like we would as practitioners in the office. This is going to, again, lengthen through that piriformis. I want to remind you that a lot of the reason you're getting sciatica symptoms with this is because you're physically compressing the nerve bundle through that muscle because of the way the pelvis is rotating.
Right.
Yeah, it's a real treat, and you're there. She's there. It's beautiful. And reminder that nerve bundle is L4 through S3, but then piriformis is S1 too. So you're really working on that sacral part, which again plays into Webster technique as well. So all of these tools are going to help your patient who has sciatica at any point in pregnancy. Now we're going to go into our reclined. Oh, you're going to stand. That's what we're going to do.
We're going to tackle the front side a little bit here and dive into the hip flexor as well.
Go ahead. Keep going.
So,
I love it.
In what we talked about low back pain in trimester 1, so those first 3 months. Here, there's a component to this, right? If we were just talking about the anterior pelvic tilt, so that hip flexor, that iliopsoas can become shortened. We want to help lengthen it so that we can hopefully help keep more of that neutral pelvic tilt instead of being anterior all the time. So if your patient is in too much pain, we thought, hey, let's get rid of the kneeling so we don't need so much of that up and down movement. This is also going to take pressure off of their knee, of course, because I'm standing, so I'm not kneeling on my knee. But just like last time in that lunge, usually we're asking our patients, this can be done really well against a wall, but whatever leg is forward, thank you, Dr. Jessie. Whatever leg is forward, you want your stabilization piece on that side. So if your patient's kneeling, maybe they're using a coffee table, a table, etc., something at home. But I can tilt pelvic, so we're looking for more of that posterior pelvic tilt, and then lean forward into that to really lengthen through the iliopsoas again. Of course, can always bring that arm up and over. This will dive into even a little bit of that round ligament, but we're talking hip flexor, the iliopsoas here. So just another nice, of course, modification. Tackling both sides.
Well, and really nice too to remember that this muscle attaches to every lumbar vertebrae. So because this is so mechanical with pregnancy, it's going to dramatically help low back pain with sciatica symptoms, right? I want to get into the ball. Now, she did talk about knees, so you do want to be really cognizant of knees, but we do love the ball, obviously for pelvic isolation and movement in the pelvis, but then also dipping into the piriformis of your home. So of course, if this is uncomfortable for your patients, don't do it. But if they're okay on their knees like this tends to be better than just doing an iliopsoas stretch. There's less direct pressure on the knee. And then with this, you can also get that extension that tends to help with sciatica type symptoms, right? So when you can't be on your belly to do a mini cobra, Instead, you can be here and you can physically dip into that spine, and then you can dip into this piriformis on the backside, and it ends up feeling really incredible for length for the patient. So just a reminder that you can really dip with the ball and then make sure they're doing pelvic isolation on the ball as well. Just super important for the movement, the mobility, the fluid that's moving through that pelvic structure. Next, we're gonna go right into the, what are we doing? Reclined.
Yes, yeah, we'll show the reclined version, then we'll bring those pillows back.
Okay.
So, bringing back our lovely wedge. Still getting into some low back, but again, the piriformis. So, wedge, of course, so we're not flat on our back.
Mm-hmm.
Before we dive into partner piriformis, I can easily cross my ankle over my knee to target, again, my own piriformis. In trimester 1, months 1 through 3, we talked about low back pain. You saw this version up against the wall for a mama who maybe doesn't have, she's not in her 3rd trimester. She's not a month out from her due date with belly. So here, being reclined, there is much more room to, of course, bring that knee towards my chest. I can interlace fingers and really enhance. And or, this is wonderful. Scarf, towel, whatever you may have at home, right around the knee, and that helps pull that knee towards my chest for me. Again, lengthening through the piriformis.
If you're doing it with a partner, or if you're advising your patients to do this with a partner, you are going to, I'm actually going to bring you out a little bit, and I'm going to switch you here, or I'm going to switch for me. The key here is actually this rotation. So it's not as much about getting into the belly, it's more about rotating, because then she'll start to feel it through the piriformis, and then bringing it just slightly forward. And what we tend to do is more of a push and release. So I'm gonna, have her push against my hand over here for a count of 3, 2, 1, and then let it go and just push forward. But it's something we do advise patients to do at home if they are truly dealing with a ton of sciatica type symptoms. Using a wedge like this is gonna allow them to not, then they won't be flat on their back, right? You're not dealing with that
vascular.
Yeah, the fear of the vascular component and them getting dizzy and woozy. So Wedge being one of the products that we love for the sciatica stuff, very, very important. Let's go right into the flexion distraction. So, yep, and she's gonna roll to her side. Yeah, beautiful. Yeah, we are big on that. I feel like we can't ever say that enough. To have patients not just come straight up, but to roll to their side and then kind of push themselves up with their arms.
Also
Okay.
demonstrating that our table here has the thoracic drop, which just creates even more room for belly if necessary.
I'm gonna hold this.
Thank you.
Leather is slippery.
Yes,
It's like a necessary evil, right? Here we go with the flexion distraction. This is not a necessity. If you have a table that doesn't have this, I ran my practice the first 2 years without flexion distraction, but I will tell you this. When you have it, it changes a lot about what you can do for sciatica, and let's be honest, sciatica is like a very big part of your practice when you're in the world of body work. It is the thing that people come to you for. I swear it's like being in the room with a patient. This is what happens sometimes when you really want things to work. They don't. They don't. I'm gonna put this in here. See, now you're getting a demonstration for how to fix the handle on a flexion distraction table without freaking out, right? Yay! Okay, so table moves like so. You're flossing the nerve. You're decompressing the spine, you're taking pressure off the nerve roots, you're lengthening the muscle tissue, you're creating fluid movement through the joint space. It's all gonna help. It's all gonna feel incredible. Patients love this. It's not a lot of rotation, obviously. Again, you don't have to, that was a really nice movement.
Yeah.
You don't have to have a flexion distraction table. If your table doesn't move, what you do instead, say it's locked, you lengthen. You put your hand here and you lengthen while they're on here to at least decompress a little bit and create some fluid movement, right? We're gonna get into the piriformis release. Locking this. When we are digging into the piriformis, again, really important, remember that there are about a third of the population with anomalies where the bundle, that sciatic bundle, doesn't run where it's supposed to. So part of these sciatica symptoms with pregnancy might be related to that. And you might be just at the mercy of anatomy. So you might not be able to get rid of it completely, but you certainly are going to help them with all of the stuff that we're doing here, especially with the piriformis. So pinning, stretching, talking to them because they're more mobile than normal, right? Because of that relaxant, making sure to let them know what you're doing, and making sure that you're checking in with them because they're face down. She obviously is a doctor and knows what's going on, so I'm not worried about how she's doing. She will tell me. We're gonna get into the last 3 products, which really is gonna be Epsom salts to decrease the inflammation. This salt physically draws out that inflammatory component and relaxes the muscle tissue. So that magnesium sulfate is going to be tremendous for pregnant women. Pregnant women ask, can I take a tub? Yes, they can. It just can't be super hot.
Right.
But it really is tremendous, and then it helps with sleep, which is also really great. The ball we talked about, make sure you tell them the right size, height based on how tall they are, which we always reference, so check the notes on this if you need a reference for the size, because it's a little different than what we typically see on the internet because it's based on pregnancy, and you want them to be at like a 90 degree when they're seated. Little different with pregnancy than when they're not pregnant. And then the belt, last but not least.
Yes.
Where'd our belt go? Yes.
Yep. On there. So we saw this in trimester 1 as well with low back pain. But again, right, especially if we're still talking about instability.
Go ahead and hold that.
Thank you. This can be a beautiful tool if your patient just needs more support.
And then you don't have to make the piriformis overwork all day long.
Oh, right. Then
What you pull. Good.
that is like the game changer, those extra 2 little support.
I'm not pregnant right now, but I do recall, and we do see this every day. So that's the nitty gritty. Those are the tools. Those are the things you can tell your patients to do. Check out our YouTube channel for more tools for your patients. You can always reference that stuff. Ask the questions, subscribe, let us know what you need, and watch the next set of conditions.